The main things with the dermatoscope, you need to have a decent field of view. It doesn't have to be the biggest one, but it needs to be a decent size, at least 25 mils. You want to have polarization and non-polarization. So polarization is a bunch of filters and lights that are going to reduce surface reflections and see deeper under the surface of the skin, just like Polaroid sunglasses would do at the beach. They cut through that surface glare and allow you to see under the water. That really allows you to see deeper into the lesion and see the structures. However, non-polarized has a place as well, and blues and greys particularly come out, but you need to use fluid with that. So in polarized you can use fluid or non-fluid on dry skin. Non-polarized you need to use fluid. So you need a dermatoscope that does both of those. The ability to change from a contact scenario to non-contact is important as well, because you'll have lesions that are elevated. You may want to flatten them out to see deeper in, but sometimes also you want to see the vessels, and if you apply contact it can blanch out the vessels. So it's important to have the ability to do both. Rechargeability is a convenience thing. It's not critically important, but it generally means you've got a more consistent power source as well. So lithium batteries tend to have a high output and then they'll die off quickly. So you're getting consistency in your light, your brightness and your colour temperature. So rechargeable is important. And then finally, I think the ability to attach a camera or a smartphone or an iPad to be able to capture images and take photos is really useful. You may want to store them, you may want to show the patient, you may want to get a referral from a colleague, or you may just want to put them in the patient notes. So the ability to capture that image, you can zoom in on it, see more detail, that's a really important part. And the beauty of the Dermalite dermatoscopes is obviously the DL 200 through to the DL 5. They have all of those features, but they've also got a universal set of camera attachments and phone attachments that will allow you to capture all those images. All dermatoscopes are optical devices generally, unless they are a dedicated digital dermatoscope, and there's not many of those around, certainly not in common use. The optical dermatoscopes available on the market, some can take photos, some can't. It depends. All of the dermalites we sell at DocStock are capable of having cameras attached to them or phones attached to them, with the exception of the very original 20-year-old DL 100 type devices. But they're magnetic connections, they're nice and easy to attach. Other brands have some that are capable and many that aren't, so it depends on the brand. But the Dermalite one certainly can all do it. If you've decided that you need a dermatoscope and you want a dermatoscope, on our website at docstock.com.au we have a dermatoscopes page under the product list, and on that page you can compare the different versions. So there's a little compare button you press, you can add a bunch of different models in there, and then it'll show you the comparison. So you can see what's the field of view of one versus the other. Which one can you attach a camera or a smartphone to, and which one can't. Which one is rechargeable. So that's a great way for you to narrow down the version that you're interested in. The top of the line dermatoscope is the Dermalite DL 5, came out about 1.5 years ago, but it is easily the biggest selling dermatoscope. It's got the biggest field of view, it's got double the battery life of all the others, it's got a bunch of other lighting features such as pigment boost for adjusting the colour balance, it's got UV mode or Woods mode in it for structures that fluoresce. It's just an all-round great rechargeable dermatoscope. So have a look on there and see all the different versions, and let us know if there's questions that anyone has about the right one for them.